Morning, Dr. Wu here, and I'm about to take a questionnaire on a study of stress management among young adults in Hong Kong. Okay, thank you for the introduction and the disclaimer. Let's go. I'm a male. Do you need to work besides yes? Which program are you currently enrolled in? Let's say, is there something else? Over the past month, how often have you felt stressed? Why not say over the past month, how often have you felt? Why not ask like over the past week or last week? Just talk about last week. It's kind of weird, the interval of the month, then you have to think about each week in the month. So over the past week, right? And then talk about the week. So over the past week, how often have you felt stressed? Oh, never. But maybe it's moderate stress or very stressed. So you may want an interval there too. Over the past week, how often have you felt very stressed? Never. Okay. This doesn't make sense. What am I agreeing with? There's no statement here. Okay, so you have Likert scale here, but there are actually no statements. What do I agree with? Oh, I think families are important. I think money is important. I think academics are important. Peer stress, nah, it's not important. I think social media, like, again, there are actually no statements, like sentences to agree or disagree with. So kindly revise that question item. On a scale of 1 to 10, how would you rate the overall impact of stress on your daily life? Extreme? Again, you may want finer grain definition, like minor stress or unbearable stress. Okay, so stress isn't necessarily a negative thing. You want maybe different intensities of stress. Other behaviors. I mean, you may want to talk about negative stress or unbearable stress or high stress. Okay. Okay. Sometimes. When you are feeling stressed during a day, maybe you want to have like a finer grained interval or a week. Sure. I mean, that can be a once in a lifetime experience. We don't know the frequency of the increased heart rate due to like unbearable stress. Okay. Other symptoms. What about sweating? You know, people sweat when they're stressed. What about if it's positive? Again, minor stress might actually improve physical health. So you want to talk about like high stress, unbearable stress, negative stress. Other? Oh, I feel more alert and sharp. With some stress, cognitively sharp. You know, like being in a competition induces sometimes like positive stress. Okay, so that's something to be aware of. So I wonder also if you need Chinese language translation. So you're talking about question 18 refers to question 17, so maybe you want to make that clear. So it's possible that someone can have a commonly used coping method, but also find it ineffective. So you're asking how common this thing is. Are these the same intervals? Well, these are not the same intervals, are they? What about 3 times a week? So you are, oh, here it is, 3 to 5 times a week, almost every day. So 6 to 7 times. Like every day is, what about 3 times in a month? So these time intervals aren't the same. You're talking about days, weeks, and months. Maybe talk about weeks, but you're talking about months. So use month intervals. Yeah, what, and you're presenting reasons here. Maybe you don't, maybe people have yes, maybe, or no, but their reasons are different. So you're not going to get what you actually want, which is merely a dichotomous question, not the additional reason, which makes it a double-barreled answer. I don't know at all. What if you don't know? It's a yes-no question, but it's not yes-no. I don't know. Absolutely not, because I don't know. Oh, completely can. What do you think the school needs to strengthen support more? Rank your top choice. Okay, so I'm just going to rank the top choice. What specific types of support do you most want your school to provide? Oh, you can... Well, if you want maybe you want to make this multiple choice instead of my being able to answer everything. I want everything. Provide... So... I'm not sure you want this because everyone can just tick everything. You aren't constraining their choices to get at their actual preferences. Actively seek. Maybe are you actively seeking psychological counseling, consulting, like right now? Help managing stress. But what if they don't do any of these things? How can they rank if they don't actually do any of those things? So kindly check the coherence of your question items and question choices. Thank you very much.